my name is Allison. I'll be your nurse practitioner today. What's your name?
Jamie.
And what's your birthday, Jamie?
6/16/61.
I appreciate you. I'm just going to wash my hands here and put some gloves on. We're going to be doing a cranial nerve exam today, all right? So pretty much everything from about here up. All right, so I'm just going to put my gloves on, and then we're going to start with cranial nerve number 1, which is the olfactory nerve, and you get to smell some stuff for me, okay? Nothing disgusting, I promise, no tricks. So I'm going to have you start by closing your eyes, and you're going to plug your right nostril, okay? And I'm going to have you just take a deep breath and tell me what you smell.
Peppermint.
Yay! All right, now you're going to plug your left nostril. And one more time, big deep breath. Tell me what you smell.
Citrus.
Yay! All right, perfect. Go ahead and open your eyes. So, cranial nerve 1, olfactory nerve is sense of smell, and that is intact. We're going to move on to cranial nerve 2, which is the optic nerve. All right. So first things first, I'm just going to do a quick visual acuity. All right. So you are going to read the smallest line for me. So cover your right eye first.
I gotta tell you, it's like,
okay.
This one is for near and this one is for distance.
Okay.
So
well, read the smallest line, whichever
I
one
actually
you can read.
LTFPH.
Perfect. All right. And now you're going to cover that eye and look with your next eye.
LTFPH.
Fantastic. All right. Now with both eyes, I'm going to have you read it backwards so I know you didn't memorize it.
HPFTL.
Thank you so much. All right. So vision is 20/20. Excellent. All right. So next I am going to look with my ophthalmoscope. So I want you to kind of look just past me. Don't look directly at the light. Okay. And we're going to get a little close and personal, okay? So, all right, and next eye. Excellent. All right, so optic discs are sharp in both eyes. We see venous pulsations in both eyes, and we have a positive red reflex in both eyes, so that is good. So next we're going to do cranial nerves 3. One more thing real quick. I'm going to do peripheral vision, okay? So once again, real close, and I'm gonna start from behind, bring my hands forward. So you tell me as soon as you can see my hands, okay? So.
Now.
Excellent, okay, and.
Now.
Fantastic. One more.
Now.
Perfect, all right. So, peripheral vision is good as well, okay? So now with cranial nerves 3, 4, and 6, the ocular motor, the trocheal, and the abducens, okay? We're looking for droopy eyes, so I see no droopy eyes. You look amazing. We are going to do 6 cardinal visual fields. So with this light, just using your eyes, not moving your head, you're gonna follow this pen light, okay? So we're gonna go. And let me know if I go too fast, okay? Perfect, okay? Sorry if I go too fast.
You're fine.
And last one, awesome. All right, so no nystagmus noted. Now I'm going to just check your pupil reaction, okay? So quick bright light in the eyes. 1 and done. 1 and done. And we have pupils are equal and reactive to light. They're at about a 3, which is normal, so that's good. We're gonna go on to cranial nerve number 5, which is the trigeminal nerve. So here we're doing sensation to touch, okay? So I'm gonna use a couple different things and I'm gonna touch a couple different areas of your face. You are gonna tell me whether you feel soft, dull, or sharp, okay? So I'm gonna have you close your eyes, all right? No tricks, I promise, okay? Tell me if you feel that, and what do you feel?
Soft.
Excellent. Okay. Do you feel that?
Soft.
All right. Perfect.
Soft.
Excellent. Okay. And one more. Excellent. All right. So trigeminal nerve sensation to touch is intact, and you felt it evenly on both sides, correct? All right. Now we're going to incorporate cranial nerve 7 with cranial nerve 5, okay? So a couple funny things we're going to have you do. First, I'm going to have you clench your teeth like, excellent, okay? I'm going to have you squeeze your eyes shut real tight. fantastic. All right, lift your eyebrows for me. All right, and then wrinkle your forehead, kind of like, yeah, good. And smile for me. Excellent. And stick your tongue out. Perfect. And puff your cheeks. All right. So facial symmetry is noted. Everything bilateral is even. Normal eye closure and even smile. And beautiful smile. So we're going to do cranial nerve 8, which is the vestibulocochlear nerve. This is hearing, for better or worse. So we're going to do what's called the Weber test. I'm going to tap this on the table. I'm going to stick it on top of your head. You're going to tell me if you can hear the sound evenly in both ears, okay?
Even.
Excellent. Okay. Next, I'm going to, again, tap. I'm going to put it behind your ear. You're going to tell me when you can no longer hear the noise. Then I'm going to move it to the front. Again, no longer hear the noise. And we're going to do that on both sides, okay? So, tap.
Now. Now.
Excellent. Okay, so one more time on the other side.
Now. Now.
Excellent. Okay, so air conduction was twice as long as bone conduction, which is perfect. All right, that's what we're looking for. We are going to do cranial nerves 9 and 10, which is the glossopharyngeal nerve and the vagus nerve. So using my tongue depressor for the purposes of this video, I'm not going to gag my patient, but typically we would have you stick your tongue out and then we would do a quick gag and we would have a positive gag reflex, okay? I'm also going to have you take a quick sip of water, all right? Or vodka. All right, so no coughing, no gurgling, no drooling, so swallow is intact, okay, which is good. Cranial nerve 11, which is the spinal nerve, so we're going to do a couple things here. I'm going to have you shrug your shoulders, but I'm going to put my hands on you, okay, and we're just checking for excellent, good strength. Now you're going to lean toward me, all right, and then lean, all right. Now you're going to tip your head up and down. Fantastic. Okay, so patient's able to shrug shoulders, symmetrical with good resistance, and then head turn is nice and strong and symmetrical. Last is the cranial nerve number 12, which is the hypoglossal nerve. This is where you're gonna, again, we're gonna have you stick your tongue out, okay, and then you're just gonna kind of against the depressor, okay? So go ahead and stick out and push, all right, push, and then up and down. Fantastic. Okay, so tongue is midline. We have good movement, good strength. I don't see any facial drooping or anything like that. So that completes our assessment of all 12 cranial nerves. Do you have any questions?
No.
All right, fantastic. Thank you so much.